Hi guys, in this video we're going to talk about the anatomy of the eye. We're going to talk about the eye in the orbital cavity. We're going to talk about the bones that makes the orbital cavity itself. We're going to talk about the extraocular muscles, their function and lesion. And then we're going to talk about the structure of the eyeball itself. And for the reflexes and the pathway, visual pathway, it's explained in another videos of the same playlist. So where is our eye, you guys? Our eye is located in the orbital cavity, and the orbital cavity is made by parts of bones that surrounds us. So how can we remember these bones? Remember that the big ones outside here, you have the frontal bone, the zygomatic and maxilla. All right, zygomatic and maxilla, they will give you orbital surfaces. It's going to be a surface. So inside here, in this separated skull bones, the orbital surface of the maxilla will give you parts of the orbital cavity. All right, so you have from the maxilla and zygomatic orbital surfaces. And from the frontal, you have a plate up here, which is the orbital plate of frontal bone. Other than that, if you guys look at the part that no one likes it, which is the deep bones deep inside. Remember the ethmoid bone, you guys, that we talked about it in the respiratory system. It gives the bones that participate in formation of the surrounding orbital cavity, nasal cavity, and oral. So the ethmoid bone will give you a plate, which is what we call here, guys, the green. All right, so that will give you the orbital plate. Okay, so orbital plate from the ethmoid bone. And back here you will have a part of the palatine bone. Remember that was also in the nose video. All right, so we have from the palatine bone. From the palatine bone we have a process. We call it orbital process. From the ethmoid we have a plate. We call it orbital plate from ethmoid. And then we have the separate bone here, you guys. Imagine that you are crying and your tears are falling deep to this structure, so we call it lacrimal bone. This is a separate bone. All right, so we have the lacrimal bone in that. And also remember that the greater wing of sphenoid will participate in formation of the orbital cavity, and even you have the orbital fissure. It lies within the sphenoid bone, the greater wing of sphenoid. So again, we have major ones: frontal, zygomatic, maxilla. They will give you orbital surfaces and plate. And deep here, we have three deep: the greater wing of sphenoid, the ethmoid will give you an orbital plate, and then the palatine will give you a small process. All right, so we have three ones: deep, greater wing of sphenoid, ethmoid, palatine bone, and we have the separate lacrimal bone. All right, so these are the bones that will form the orbital cavity. Now moving on to the muscles of the eye, guys. When we talk about the extraocular muscle that move your eye, we have 4 recti muscles. All right, we have one superior, it's rectus, because it's a straight muscle and it's a deep muscle here. We have the superior rectus, we have inferior rectus, we have lateral rectus, and there we have medial rectus. If we have a top view, superior rectus is here, inferior rectus is down there, and then in the nose side we have the medial rectus, and laterally down here we have the lateral rectus. All right, it's the whole thing. We don't have anything here laterally muscles other than the lateral rectus, so it's deep and up. However, superiorly we have one muscle that covers the rectus. It's removed here. It's the levator palpebrae. And medially we have the superior oblique that covers the medial rectus. However, lateral rectus doesn't have any muscle in her place other than herself. All right, so these are the recti muscles. The recti muscles will move the muscle as you would expect. The lateral will move it laterally, which means abduction. Okay, fine, we're going to talk about the muscle function as we proceed better. So you guys now remember that we have muscles that moves the eyeball. We have 4 recti and 2 obliques. The superior oblique comes superiorly, and it comes from the same common tendon for all of them, and it wraps around a trochlea, all right? And that is when it comes back to get attached behind the equator of the eye. And it's very important to know that the obliques muscle are attaching behind the equator, because that will give you opposite function. Yes, it's a superior oblique, but it causes depression because it runs behind the equator. Suppose that someone is turning his hand all around your head, and he's touching your head from the back side, although he is up, but when he tries to pull your back of your head will get down. So it's very important to understand that when you have an insertion behind equator, it will give you opposite function. And the superior rectus is normal. It's in front of the equator. So yes, it's superior, and it causes elevation because it's superior. It brings it up. All right, we're going to talk about the function as we proceed. And the last muscle down here is the inferior oblique. It has the same thing. It comes and it kind of rotates, and it attaches behind the equator exactly the same way the superior oblique does. Okay, so as for this slide, you guys need to know that we have 4 recti muscles. One superior, one inferior rectus, one medial and lateral recti, and we have only obliques, 2 superior and inferior. All of them are attached in front of the equator, so they will give you a function that makes sense. However, the obliques, they attach and insert behind the equator, so they will give you kind of reversed function, and we're going to talk about that as we proceed. So this is a nice slide, but I just want to explain to you everything in detail. So what kinds of functions, guys, do we have? We have 3 major planes. And when the eyeball moves around one plane, it will give me 2 opposing functions. In the case of when I have the eye, and if this eye is like that, and let's say that this is your nose is here. So if your eyeball rotates internally, this is what we call the intorsion, internally. And if my eyeball rotates laterally, we call it extorsion. Okay, so this is the first function we have. Remember, guys, for the intorsion and extorsion, now, first of all, medial and lateral recti, they will do abduction and adduction. This is very simple, and they are out of the fight we will have today between the superior and inferior muscles we have. So the medial rectus causes adduction, the lateral rectus causes abduction, and let them be out of everything, because we will have 3 functions for the superior ones and inferior ones, and we need to understand how to memorize them, and we need to understand them. Okay, so if we want to finish the abduction and adduction, this is your eye, all right, and here is your nose. So if you move your eyeball like that, and you are going to the midline, so this is adduction, and of course it's the medial rectus, right, guys? So this is the medial rectus. And if you have your eye and you move your eye laterally, all right, so, and this is here your nose, so this is definitely the lateral rectus, right? So this is the lateral rectus. You want to see how that happens? If you guys look, you have here adduction and abduction. All right, again, abduction, adduction. All right, so this is what happens in add and abduction. Now, the medial rectus and lateral rectus are quite easy. Now we want to get back to the intorsion and extorsion. How that happens? This is intorsion, and this is, again, the other one was extorsion. So again, this is intorsion and extorsion. So when you rotate your eyeball internally, this is intorsion, and when you rotate your eyeball extorsionally or externally, we call it extorsion. How would I know in and out? Because of my nose. If I am rotating towards my nose, this is in. If it's away, then this is out. Which muscle does the intorsion? It's the guys, the superior oblique. So the superior oblique, okay, the oblique muscle is the chief rotator of the eyeball, guys. It's the most important muscle that causes rotation of the eyeball. Remember, because in the superior oblique lesion, the main problem you will have is the intorsion. It's very important because superior oblique is a separate muscle. It has separate nerve. So I would expect to have a separate lesion that is specific to it. So if I understand that the superior oblique is the main one that causes intorsion, and if I have a lesion in it, I will lose that function. However, we will talk about the nerves of the other muscles, but many of the muscles, many of the functions, the more than one muscle causes it. So if I have a problem in that, it's not gonna be shown like the muscles that have separate innervation and separate exact function. We're gonna talk about the lesions as we proceed. So the superior oblique will cause the intorsion, and the inferior oblique will cause extorsion. So the extorsion and the superior intorsion. Okay, so this is the main function, intorsion and extorsion, and of course the recti will also do that, and I will tell you how to remember that. But as for here, okay, fine, we can say it now. the superior oblique will do intorsion, and also the superior rectus, but this is just a helper muscle, it's not the main one, it will do intorsion. And the inferior rectus will do extorsion. So how will you remember that? The in one, the in is by the S people, and the X is by the N people. Okay, guys, so now we remember the function of intorsion and extorsion by which muscles? Intorsion, superior oblique, superior rectus. Extorsion, inferior oblique and inferior rectus. But the main players are the obliques ones. And remember the superior oblique muscle very importantly, because we will talk about the function of that, and we will lose the intorsion if we have a lesion. Alright, guys, so this is all about intorsion and extorsion, and that was all about adduction and abduction. Okay, all about them in terms of the recti. Now, we want to talk about the obliques and the superior ones and inferior ones, because they will also participate. How can we remember who is doing abduction and who is doing adduction? Here, guys, down you have the abduction. The obliques, guys, the superior oblique and the inferior oblique, they will, the ob and ob, they will do abduction. And of course, you know that the lateral rectus is the main one. Okay, so abduction, oblique, oblique, and the other ones, the superior and inferior recti, the superior and inferior rectus, all right, they will do the adduction. So the recti will do adduction. So in intorsion, extorsion, the in is made by superior oblique, superior rectus. The extorsion by inferior oblique, inferior rectus. In abduction and add, the ab obliques, superior oblique, inferior oblique. The add by the opposite ones, superior rectus, inferior, because now we are having fights between the superior people and inferior people. Out of this fight, medial rectus and lateral rectus will do adduction and abduction. This is quite simple and easy. Now the last function, guy, is the elevation and depression, and we already talked about that. We said that the superior rectus, because it's superior, it will do elevation, right? If this is your eye and you bring it up, this is elevation. Who will do the elevation? The superior rectus, because it's above. And if you have an eye and you look down, depression, this is what we call depression. So who will do that? The inferior rectus, because it's inferior. What about the obliques? It's the opposite, because this is the equator, guys. So the superior oblique when it will try to pull, although it is a superior muscle, it will bring it down. So yes, here the elevation is superior rectus and the depression is inferior rectus because of their position, but the inferior oblique will do elevation because of the equator kind of information we said, and the superior oblique will do depression. Okay, guys? So again, let's go back. Intorsion, superior ones, superior oblique, superior rectus. Extorsion, inferior ones, inferior oblique, inferior rectus. Abduction, adduction, we know the recti, medial and lateral rectus, easy. The abduction, superior oblique, inferior oblique. Adduction, superior rectus, inferior rectus. And the last thing, based on their location, the superior rectus is above, so elevation. Inferior rectus is below, so depression. The obliques, although the superior one is above, but because it attached behind the equator, it will do depression. Like I told you, try to make someone to hold your head from the back with his hand, although his hand is above, but when he moves your head, you will look down. This is the idea of the obliques. All right, so the superior oblique will do depression, inferior oblique will do elevation. Now, one important thing, guys, I want you to know, because this is very important in clinical examination. They will ask you a question. Like I told you guys, in the superior oblique, superior rectus, and inferior oblique, inferior rectus, those guys are having fight. They are doing things together. Sometimes in the exam, you want to isolate and make sure which one is having a problem. Is it the superior oblique? Is it the inferior oblique? Is it the superior rectus? Is it the inferior rectus? So abduction and adduction position, guys, will help you to do that. If you are in the place of abduction, if you are far away from the recti, I will show you something to help you. Can you guys see? We are here in adduction. We are here in adduction. Now the eyeball is adducted. It is rotated medially. So here you guys, when you are, your eyeball is toward your nose, it means the obliques are functioning. So in adduction position, you can isolate the obliques. This is the superior oblique, and down the inferior oblique is doing the elevation and depression. Because you guys know that the obliques and recti are doing elevation and depression. Sometimes you want to know which one is affected. Is it the obliques or recti? I want to isolate the muscle. So keeping the eyeball in adduction position towards the nose, because the trochlea that your superior oblique is wrapping around is here medially. Okay, so here elevation and depression are made by the obliques muscle. All right, so getting back to this, in adduction, let me show you the muscle here to make sense more. If you guys look at the eyeball, your eyeball is here in adduction position. When it's in add, we are selectively working with the oblique people. Okay, so the oblique peoples. But who will do elevation and depression? You know, this is attaching behind the equator. So the superior oblique will do depression, and the inferior oblique will do elevation. Okay, so in adduction position, the obliques are working. Although the obliques are doing abduction function. This is something else. I told you how to know the function. This is another concept. If you put your eyeball in adduction position, you are selectively testing the oblique muscles. All right? It's the opposite. So remember, study the functions first, the way I told you, and then study the selective testing of muscles in clinical examination. And now it makes sense. However, if you guys look at in abduction position, see, the recti will do elevation and depression. Again, recti, depression. Okay, it was an elevation first and then depression. So you can see that the obliques are not doing anything in abducted position. Okay, guys? So in abduction, the opposite, the recti are working. the superior rectus will do elevation, and the inferior rectus will do depression. Quite simple, because inferior is inferior, so depression. Superior is superior, so elevation. But the obliques are opposite. Okay, guys? So now we know that the function of all the muscles, we know that the intorsion, extorsion is mainly by obliques, but the recti can help. How can we remember them? In by superior ones, X by inferior ones. And then we said that we have abduction, adduction. The main player is the medial and lateral recti, but let's take them out of the play and focus on the people who are fighting. Abduction by the obliques, adduction by the recti. And then we said that we have elevation, depression, and by the name, superior rectus will do elevation, and by the rotation, of course, inferior rectus will do depression. But because the obliques attach behind the equator, the opposite is true. Inferior oblique will do elevation, superior oblique will do depression. In clinical examination, let's put all the function on a side and think about, based on the eyeball location, the muscles will work. If I am in the abduction outside, the recti will do elevation, depression. If I am in adduction position, the obliques will do the function. Superior oblique will do depression, and inferior oblique will do elevation. Can you see? Okay. All right, guys. Now, so this is just a summary for you guys to remind you about the functions. All right. Now let's look at a practical note and see how, guys, the recti are coming in a straight like motion. That's why we call the superior rectus, inferior rectus, medial. What is my nose? Here is my nose. So this is medial rectus and this is lateral rectus. And these are the main muscles. Okay. Now we will have people that will come into play. And let's look at them from here. If you see a muscle that comes from, wraps around the trochlea, remember the trochlea that will help your tendon to go behind the equator, so that's why it's making the opposite function. This is going to be your superior oblique, and it comes from above and it covers your medial rectus. So in medial rectus position medially, you have this deep, and the superior oblique covers it from the top. Remember I told you lateral rectus doesn't have any muscles around it, but all other people, they have. So the superior oblique is on top of the medial rectus, and this is how it comes. Inferior obliques comes from the floor of the orbit, and it goes behind the equator. So we have another muscle deep to the inferior rectus, which is the inferior oblique. And then the last muscle that in the upper position, it's the levator palpebrae superioris. It has nothing to do with my eyeball, but because I told you guys in each location you have two muscles covering your recti. Except the lateral rectus. Okay, so the superior rectus is covered by levator palpebrae. The medial rectus is covered by superior oblique. Inferior rectus is, we cannot say covered because it comes from down, but it covers from outside. So it's down to it is the inferior oblique. All right, and the lateral rectus has no one to annoy her, and this is your orbital cavity. Now let's, guys, come to the innervation and lesion, because it's very important to understand them. And of course here, this is your brain, and you know from the cranial nerves that this is your oculomotor nerve, and the very thin one that wraps around and appears from here is the trochlear, and this is the abducent one. Okay, so and we talked about the order of nerves in the early cranial, neuroanatomy videos. So this is cranium number 3, and this is 4, and this is 6. Now, what are which nerve supplies the muscles? All muscles of the extraocular eye muscles are supplied by oculomotor nerve, except superior oblique. It's by the trochlear, 4th, SO4, and LR6. And it looks like the chemical equation from high school. Okay, guys? So the lateral rectus is supplied by abducent. The superior oblique is supplied by trochlear. Okay, SO4, LR6. And all of the other muscles are supplied by oculomotor nerve. Now, why is that important? Because if I have a lesion in my eye, I need to understand